Hi, this is Jenny Langley, author of the new Maudsley Training Manual. In this video, we carry on looking at the Nutritional Risk Ruler, exercise 10.4 in the manual, and another scenario, and then some kind of summary points that you might find useful. So in this video, we're looking at a slightly older teenager. So Rachel is 19, and we're thinking about looking after nutritional health at university. So this is a really important issue for all families of teenagers going off to university to be thinking about. And you might also want to watch my videos on the concept of reasonable risk as well, where we look at the university examples in a slightly different way. So you've got Rachel, she's had a gap year, she's really looking forward to going off to university. She was discharged from the outpatient eating disorder service just after her 18th birthday. She's gained a little more weight over the gap year, but she's really not happy about that. She's announced to her family friends that she's going to be vegan. She wants to be super fit and healthy, and also the environmental issues when she goes to university. Rachel's mum Claire is really distraught because she's terrified that this is going to trigger a huge relapse back into the anorexia and maybe back into the eating disorder services, maybe even hospitalisation, whereas her dad James feels a bit more optimistic and calm. So they agree again that he should be having the conversation with Rachel. So maybe they have the conversation on a dog walk. So James open up with noticing everything that's going well for Rachel. So getting the connection, the relationship through everything Rachel has achieved. I'm so proud of you. You've done so much. You've been on your travels. You've done your ski season. You did well at school, despite having your issues with your eating disorder. And you must be really excited about going to university. We're so excited that you're going off to this new stage of your life as well. So then being curious. So I'm curious about your decision to be vegan, Rachel. You've always loved your meat and fish, and you're such a good cook, having cooked for all those families in the Alps. So help me understand. You know I like doing things in numbers. Haha. On a scale of 0 to 10, how confident are you that you'll be able to manage your own nutritional health when you're at university? So let's imagine Rachel's happy to have the conversation. So that would be good because it means that she's already thinking about this. I don't know, 8 or 9, I guess I'll find out when I get there. James, I'm impressed at your score. I know you've been struggling with your weight lately and you're planning to go vegan. So just again, calmly observing. I also know you're determined to work this out before you get to university. Help me understand what leads you to give yourself that score. So he's using a really, really affirming approach. And it can often elicit positive statements from the patient about their own ability to look after their nutritional health. So they can consider positive thoughts that they've been having or ideas that they've had, but might not have really kind of taken them to the next level or been able to recognise those attributes that they have. So any time that you're giving reflections, so you're repeating back their words, you're drip feeding affirmations, you're kind of feeding into the young person's reward centre to help build their confidence before they embark off on this next stage in their life. Okay, now the most important thing is to have no hint of criticism or hostility or judgment when you're having these conversations. So even having this first conversation is a good step towards planning for university. Then Rachel might say, Dad, I know Mum's really worried about me, but I have thought about this already. I have an appointment next week with a nutritionist, so a piece of information the parents didn't know, because I've been doing a lot of reading and there seems to be a view that humans cannot exist on a pure vegan diet. Maybe I'll need to take some supplements. Also, I found out there's a vegan society at university that meets every week. They've written a really useful booklet about being vegan at university. I can show it to you when we get home. I like the idea of veganism. It's good for the environment, kind to animals and all that, but I'm not going to let it ruin my time. Maybe I'll be vegan 60 to 80% of the time, or some people call it flexi-vegan, don't they? So in spirit, I'll be vegan, but that doesn't mean that if I go to Nando's, I can't eat because there's only chicken. So I can be flexible around that. I'm certainly not going to go back down that slippery slope into an eating disorder. My life is so much better now. Anyway, thanks for caring, Dad. You and your silly ruler, kind of like having a laugh about it. But these conversations, walking the dog or out in the car, can be really, really useful in terms of helping your loved ones to visualise what they might need to be preparing or being able to communicate with their parents. Well, this is what I've already done. I've already made some plans. I just hadn't told you about them. So it's a really good way to open up the conversation. So let's imagine that actually Rachel doesn't want to have this conversation. She's feeling really defensive. Dad, can't we just enjoy the dog walk? I wanted to talk talk to you about your plans for retirement. I know you and Mum are worried, but there's really no need. I have it all under control, so you don't need to worry about me going to university. James, well, yes, darling, your mum is worried. Perhaps at some stage we could all sit down together, just do some planning around your move to university. We did the same when your older brother was going to university. That would help calm her fears. So James is rolling with resistance, but keeping the door open for the further conversations later. And he acknowledges, yeah, your mum does worry. And that's okay. You know, we'll work it out together. We're team family. So thinking about that contingency planning, so again, maybe at a later stage, maybe the next day or the next week, they can sit down together and they can think about, you know, visualizing the way how Rachel's going to feed herself at university. So the type and amount of food available, food shopping and preparation, meal times. Is it she preparing her own meals, or is it a buffet? Is it in cafeterias the whole time? Social interaction at meal times, going to parties, all that sort of thing. It can be really useful to visualize those in advance. So then there's some really useful guides and booklets for young people heading off to university. Okay. And then highlighting the unconditional love. So if there's anything else I can do to help with your planning and preparation, then just say, I'm more than happy to support and help you in any way that I can, both practically and emotionally, and of course financially. We are the bank of mum and dad, aren't we? I trust that when you would like help, you will ask me. The offer is always open. So again, Dad's really kept that connection with Rachel, even though she was a bit defensive about having that conversation. Okay, so just in summary around the nutritional risk ruler, think of it in terms of there's 7 key steps. So you don't have to use all of these steps, but these are just some ideas. So you can use it to open a conversation about how confident is your loved one in terms of looking over after their own nutritional health. Then you can follow this up with reflections, so repeating what they've said, and then being curious, not furious, and maybe, you know, tell me more about your score, what might help you to increase your confidence, what other help might you need? Are there things that might reduce your score? So thinking about what might trip you up. Then the third thing, if your score, the score that you would give, is different from your loved one, then ask permission to share that. So this is what I've been noticing, or this is what we've been noticing. We could only give you a score of 4 rather than 10, or it might be, actually, we could give you a score of 8 rather than 4. So you might be more confident than they are. They've just got this kind of lack of confidence from having had the awful experience of recovering from an eating disorder. And then number 4, so explaining calmly the reasons for your score. So going more into that. So I've noticed you're cold and wearing lots of layers. I've noticed skipping lunch. The doctor tells us your observations are a bit off at the moment. I can see you're losing weight, but again, without any criticism or judgment. Number 5, acknowledge your loved one's autonomy, whilst also being curious about his or her support network. So it's up to you, darling, how you manage your nutritional health. You're the only one who can decide this. We're here to help you. Who can help? Maybe not us, maybe at university, there's a whole other support network that you can tap into. What sort of help might they give you? And then number 6, backing that up with we are here in the background to provide you with that support. And number 7 is always, as parents and carers, being prepared to step back in and take over if medical risk starts to become unacceptably high. So you might want to also watch the video around the nutritional risk ruler when medical risk is much higher. Thank you.